So I get asked a lot why the NeuroFirst approach. There's a lot of different approaches out there for back pain, but this particular video series is unique in that it combines the NeuroFirst approach with the McKenzie protocols. And I've been in the healing arts for over 20 years, and this is the approach that I found to be the most effective for the highest number of people. So I'm glad that I can finally offer this online as a video course instead of offering it in my clinic. I'm so busy in the clinic right now because of the success that we've been having. And so being able to open this up to more people is really close to my heart. So in terms of pain science, pain arises through a complex process, and it's primarily a learned response that happens in the nervous system, and everybody perceives pain differently. So if 10 individuals come into my office and I, work on them, they're going to perceive that pain very differently. And so in chronic back pain, which is really what we're focused on here, parts of the brain are plastic, and so they can change, they can adapt. And this adaptation can make it more difficult for people to get out of pain. And so that's why we integrate the sensory and safety aspects of the NeuroFirst approach so that we can also regulate the nervous system as we work on the tissue dynamics through the McKenzie approach. So as I mentioned earlier, we're really focused on calming the nervous system. And by calming the nervous system, we can help you reduce your sensitivity to pain. So we do this through breathing exercises, mindfulness, gentle movements, all those sort of things. And then sensory is working directly on the body map in the brain. And we call this proprioception. So the better your brain can perceive your body in space, the less likely you are to have pain. And so through doing some gentle sensory stimulation, we can improve the way that your brain maps your body. And that improvement often leads to a reduction in pain and improvements. Once we've done that, we start to restore function. And this is where the McKenzie protocols come in. They're restoring the function, reducing the stress on those different tissues that we've identified through the quiz, and helping you to recover fully from the back pain that you're experiencing. So let's talk about McKenzie. This is Mechanical Diagnosis and Therapy, or MDT. It was developed by Robin McKenzie, who is a physical therapist. And these are the three principles that we use in determining what treatment is going to be the most appropriate. So the first is the tissue response principle. Tissues respond predictably to different loads. And so if we move in a certain way, that's going to produce a predictable effect. By knowing the predictable effect, when we ask you to move in a certain way, we're either going to get that predictable effect or we're not. If we get the effect that we're looking for, we know that we're doing the right thing and we continue doing that. And if we don't, then we know that there's something else going on and we're not stressing the right tissues and we need to dig deeper. There's also a concept called centralization, which is a way that we recognize the pattern of symptoms. And so we're basically trying to get centralization to happen. And centralization is a good thing, and it basically means that the symptoms move towards the spine. If there's any symptoms in the butt, in the thigh, in the leg, or further down into the foot, we want all of those symptoms to centralize. We want them to move towards the spine. And this is an indication that we're doing the right thing, working on the right tissues. And so it confirms the mechanical classification that was done by the quiz. And it helps us to know that we're doing the right thing at the right time to get the right result. And then there's treatment specificity. So some movements that we do will appear to worsen symptoms. And so we want to ensure that we're very specific in the type of movements or the type of treatment that we're utilizing. And sometimes those things will get worse, but as long as it's next to the spine, that's usually an indication that we're doing the right thing. If we ever have any symptoms that get worse in the butt or the thigh or the leg or moving down into the foot, then we know that this is not the correct approach, and we need to find the approach that is going to be appropriate for the person. So why self-management? Why don't I just have everybody come into the clinic and do the McKinsey protocol face-to-face with them in the clinic? And the reason goes back to, how many people have low back pain. And really, the evidence shows that the best treatments are the one that people can do themselves at home, and also that the education around the back pain is extremely important. So the more that you understand what's going on and what to do about it, the more capable you are of having the self-efficacy to take responsibility, take control for your health, and do the things that are going to help alleviate this pain. If you're constantly dependent on me or another provider, it really is disempowering. And so this course is designed to empower you and to give you the tools that you need in order to heal your own back and to know what to do next time you have a back pain episode.